This is KEZI 9 News, breaking news.
I'm Brian Anderson. Lane County public health officials are holding a press conference right now to update us on the coronavirus here at home. Let's listen in.
Tests have been sent to our various lab partners for testing. That number, again, is likely far higher. And we are getting these numbers retroactively, so they're coming in. We're doing data collection to try to get as many of those negative numbers as possible. To date, we have 12 positive tests. 12 of those 537 have come back positive. There were 3 over the weekend that we announced through local media. I'd like to give you a brief update about those individual cases. So 2 of those cases were members of the same household. Contact investigations with those individuals happened yesterday and are continuing today. And we're still learning more about those cases. If there are public exposures or points of public exposures, we will be announcing that as well. Our third case is a woman in her 30s. Her initial symptoms started on the 16th of March. And they really started with a non-productive cough. And in addition to that, the same similarity that we've seen on a number of our cases, which is that loss of taste and smell. So something to be aware of there. Then they progressed into a fever, fatigue, muscle aches, and then finally some nausea as well. And then she was tested on the 24th, I believe. So that's the cases that we've seen over the weekend. Again, we are doing active case investigations at this time. That process can take a while. As you can probably imagine, an individual who has tested positive for COVID has a lot on their mind, and trying to recount what has happened over the last 2 or 3 weeks can be a complicated process. And so if people are wondering, you know, how is this information really rolling out? Why do I see the test announcement or the case announcement, and then later on, slowly I hear about these public exposures? Really, that just has to do with the communication and the way in which we have these conversations with the individuals. Also, sometimes people are too sick to have the conversation, and so we're having to rely on family members or loved ones who can relay those pieces to us. And so it is a long process. We appreciate your patience. That brings me to an update on our public exposure, which we announced over the weekend. As you will recall, there was an interfaith service that happened at the First Christian Church here in Eugene on March 11th, and that was obviously over 14 days ago. So a lot of folks asked, why are we making this announcement? Why did it take so long for this announcement to be made? Well, this particular case had some medical conditions which made it really hard for them to be able to understand whether or not this was out of the ordinary for them. Finally, it progressed to a point where they assumed that they potentially had something in addition to their normal symptoms and went in to get tested and seen by a medical provider. So really, there was that gap, that lag, and that's also a reason why we saw so many points of public exposure. And then, you know, our recommendation for those individuals who attended that service, since it's been 14 days, what we're really looking for are individuals who've had symptoms since then, and then working backwards from there. So there's going to be a nuanced approach to this. There's not a black and white for every single individual. Obviously, everyone's health and their individual situation really plays into this as well, and we have to evaluate that on a case-by-case basis. So our public's consideration on that point is very appreciated as we're continuing to try to do this work. Additionally, I'd like to just touch on the fact that a point of good news is that a lot of the cases that we're seeing come in have had very few points of exposure. This is probably due to the fact that the governor's orders took place when they did, and that we have been, generally speaking, as a community, abiding by those social distancing pieces. So folks are not making lots of trips to public places, and that's really helping overall in the effort. I'd like to also get in very briefly to our priorities for this next week. As an emergency response, I think it helps for our public to understand what we're working on. In addition to the response effort, so there's a big piece of this, including those communicable disease investigations I mentioned. that is really just responding to the new information and what's coming in. But then we also have to plan and look forward. How are we going to be reacting this week, next week, and weeks to come? So one of those is obviously our unhoused community, and we're excited to be working with our partners at our cities, Eugene and Springfield, and other service provider partners to try to really drill down on that effort. And we're expecting a lot more cooperation and participation on that front, which is going to enhance our efforts overall. Enhancing data collection. So you've heard from public health that we need more data. Public health is a science, and therefore it's based on data. And we don't have a lot of data. I think it's important to be upfront about that. But we are looking into other options on how we can collect what data is available. One of those is called syndromic surveillance, and so that's really looking at pockets of individuals in the community who have symptoms. We might not be able to test all those individuals, but just understanding where symptoms are taking place, how widespread that is important. It's something that we do in the flu every year through a system called Essence. This situation with COVID is different because we don't have as many contacts with local providers or discharges from the emergency room that we would normally have with, like, let's say, influenza. So what we're looking for is ways to collect that data, potentially even self-reporting, and then being able to track that and derive some conclusions based on that information. Additionally, we're looking at expanding the implications of the known cases. So right now we have 12 cases, and while that is a small number, the information that is within those cases and what we learn about them is pretty rich. And so what we're doing is working with our data team to really try to tease out some of those points and make some information as we get more and more cases available to the public and help everyone track on what we can learn from these cases that have been known in our community. Finally, a priority is testing. So it is certainly of top of mind to our community and communities across the nation. We are currently evaluating the rapid testing options and whether or not that will be something that individual doctors' offices will purchase or can afford to purchase, if public health can be a part of that process, and then also our larger hospital groups. So that is happening right now. There's a lot to be learned about rapid testing. As you know, there's one option through Abbott, a company called Abbott, that has made it known that they can receive a positive test result in about 5 minutes. They are able to utilize these kits, and I hate to use the word kits, but that is what the term that they're using, that already has all the chemicals necessary to process the test. That is actually sent to a point of contact like a doctor's office, and then they can process those tests in small batches, but we do see use for that. So we're really evaluating how we can roll that out or whether or not public health can help in that effort. So the final option on testing too is some of our larger partners in the community helping to make testing available right here in Lane County through the traditional long-form lab process. The same thing that we've seen at the State Public Health Lab and in some other labs across Oregon and the West Coast. And so you can be seeing, probably expecting some news on that this week. My understanding is that there's some movement today that can potentially be announced. I don't want to necessarily set the expectation that we're going to have a fix-all on the testing situation because we still have shortages on those very needed chemicals to process the tests. But I can assure you that it is top of mind to public health, to all of our healthcare providers to expand testing and do it now. So that is something that we're certainly working on. We've been asked, what can we tell by the numbers that we have so far, the 537 negative tests and the 12 positive tests. And there's not necessarily a lot just based on those two figures. However, according to our health officer, there's two options really that you can derive or two conclusions that you could potentially come to from these numbers. One is that the biggest wave has not necessarily hit us yet. So that's that surge we're talking about. And that's good news in a way because it allows us more time to prepare and more time to make sure that our hospitals won't be overrun if that hits. The second option, and we still, again, don't know which option is true yet, is that our social distancing and the governor's orders are really having a positive effect at slowing down the tests, or the positive tests that are coming in. And so as we wait to see which one of those is predominantly true, and it's likely a mix of both. We will certainly be sharing that information in our conclusions. I would really like to set the expectation for our community, though, that we are doing our very best to try to process the information here locally, make it available for you all in the greatest capacity we possibly can, and then also start to connect the dots on some of the implications. So we will be looking into more information and sharing that with you as we go forward. At this time, I will take any questions from our media.
First question, Emma from KZI. Do we think the farmers market being open still is a good idea?
So this first question is from Emma at KZI. The question is the farmers market being open still a good idea? And so really what I would do is fall back to the governor's order on essential services, and certainly food is one of those. And those essential services have been directed to really follow some very strict social distancing guidelines. And so, you know, obviously, you have a business that can follow guidelines, but then it also takes public participation. So with the farmers market, I know that they have the information and the proper social distancing protocol, and I know that they are trying their best to make that work. The other piece of it really is a contingent on our public. Please, as you go out and you utilize things like grocery stores, you utilize things like the farmers market, that you bear in mind your responsibility to keep that distance between you and other people. You know, the stores, the farmers market, they can put down guidance for you, but whether or not you follow that guidance is really up to you.
How many people in Lane County are being tested, and what is the criteria to get tested?
So this question is from Kennedy at KZI. How many people in Lane County have been tested, and what is the criteria for getting tested? So we have made it pretty clear, I think, what we do know. And so that is not a full picture. And we have to be honest about that the 537 negative tests is likely lower than the full amount. And the reason for that is our labs, as they process the tests, are really prioritizing communicating those positive test results. So we can say that we know how many positive tests we have coming back from those 537 roughly, but we don't know how many, the full body of negative tests. It's likely higher than 537. The second part of her question is, what are the criteria for testing? And so that ranges. I think this deserves a little bit of an expanded answer, so I apologize, but I think we need to make it clear what role public health plays in this and how testing is still working within our community. So at this point, the way testing is still happening is through a medical provider, a doctor, through their evaluation of you. Those doctors have received information from the Centers for Disease Control and the Oregon Health Authority through local public health on what the criteria should be for testing. Those guidelines are really made in order to preserve the limited number of tests that are available nationwide. So you see lots of different numbers being floated around. High population areas will have higher numbers of tests. Here in Lane County, we believe that our testing numbers, and this is just an assessment, are commensurate or on par with other areas. We have a lower population, so our test numbers are really matching more or less the national average. But those are ordered by a medical doctor. Using that criteria we've communicated, they make that assessment, and then they're sent off to a lab. Now, each individual lab has different criteria for the kinds of people and kinds of cases that they will test. You know, again, that is to preserve those resources. The state public health lab up in Hillsborough is only testing people who really meet that litmus test of needing to be hospitalized, the most severe cases. Other labs are also taking tests from individuals who are in certain risk groups who might be experiencing symptoms, like individuals with compromised immune systems, individuals with compromised respiratory symptoms, or complications. But each individual lab has a different criteria. And so we're seeing a variability on who's getting tested. We're also seeing that is leading to a lot of confusion and frustration from people who are calling their provider, and the provider is telling them that they can't be tested, even though they are experiencing some pretty severe symptoms. I think that that is to be expected, as each individual provider is looking at you as an individual and assessing your health history. and what they know about you, and then really making that determination based on that versus what resources are available and trying to be good stewards. I also think it's important for people to understand that the recommendation is going to be the same. If you get tested or if you don't get tested, you're going to be asked to stay home, and you're going to be asked to separate yourself from other people in the event that you have COVID or any other number of respiratory illnesses, so you're not passing that along. So obviously people want peace of mind, they want to know they don't have COVID, but the recommendation is really going to remain the same. So hopefully that elaborates a little bit on the testing situation. We're going to do our best to continually try to explain this, but I don't want people to believe that public health can somehow ramp up testing by ourselves. This is a community-wide effort, and certainly we're trying to do our part. We're not processing those tests. We don't have a lab here. Public Health does not own a lab in Lane County, and so we're relying on our partners, both locally and in the region, to get this done.
Brian, KZI, what are we doing to address security at the 2 respite centers for the unhoused?
So Brian's question is, what are we doing to address security at the 2 respite centers for the unhoused? And I'll have to get back to you on that, Brian. I don't have that answer off the top of my head. I do know that that is a top priority for us, the safety of those individuals, and we do have staff in place there 24 hours a day. And those staff are tasked with various functions, from evaluating health symptoms to make sure social distancing is happening, communicating information, providing food, and I'm sure that security is part of that, but I will need to get a more detailed response for you.
Alex at KVAL, are there obstacles for public health to obtain more tests, and what would need to happen in order to obtain an adequate number of them?
Alex from KVAL, are there roadblocks for local public health to attain more tests, and what are the roadblocks, or what would those roadblocks be? So again, local public health does not provide the tests. Local public health, really what we do is we take the recommendations, we weigh those recommendations based on our local situation, and we work with our providers, our medical doctors, to assess individuals on whether they should order a test or not. What we are trying really hard to do is to be an advocate for our community, to push state and federal officials to make more testing available. One of the greatest impediments to testing right now is the chemicals needed to process the test. So we need a greater supply of these chemicals, and however that happens, that's what really needs to happen. That is going to happen at the federal level. It's also going to happen at the state level. Here at the local level, since we don't have those labs, it's not really going to be of an effect here locally. When we're talking about some of the rapid tests, they use a smaller amount of chemicals, and they do a smaller batch testing or individualized testing, excuse me, like the Abbott test, for instance. That could potentially be a solution, but what we have to do is evaluate that. We can't rely on a news story or some other report about the efficacy of these tests. We have to actually evaluate it, look into it, and that takes some time. I know that's frustrating. People want answers now, but we have to make sure that whatever we do, it's going to be an effective strategy and not just something that rolls with the momentum that we see happening in other places.
Rachel from KLCC, with more tests supposedly becoming available, do we expect more testing locally?
So testing is certainly a hot topic. The question is, with more testing rolling out here locally, do we expect more testing to happen? Again, with all the complications around testing and shortages, I want to make sure that we have that caveat, that disclaimer in there, that there still are the shortages necessary to process the test. That hasn't gone away. That is still very much a real problem. More testing availability should be happening. What that will look like is probably not the entire county being able, all 375,000 people being able to be tested, but it will expand our capability. It will allow us to look across the great number of individuals who are experiencing symptoms and be able to evaluate a greater number of those individuals. But I think it's important to outline there is no magic bullet on testing. It's not going to be an overnight thing. We're working on various avenues to increase that, and it'll be incremental. So what we are really hoping for is that this week we'll see improvement, next week we'll see improvement, and we'll just keep on building on that, understanding the urgency and the need from our community. And that's all we have. Thank you.